All right, there's always things to do in the beginning. So, welcome. Let's get started. I'm really excited to talk about this stress and gut health. So, thank you for tuning in. So, I am a naturopathic doctor. I am board certified and licensed in the state of Connecticut, still able to practice in our wonderful state of New York. And I hold my license for acupuncture in the state of New York. And I'm also a Reiki practitioner. I also have experience as a personal trainer, and I got started on this journey as a health coach. So how naturopathic medicine works. So if this is a new medicine that no one has heard about, I'm going to tell you the basic tenets as a naturopathic doctor, what we swore on our oath. So first, do no harm, treat the whole person. We believe in the innate ability of the body to heal. So we support the body with all of our natural modalities that are proven and effective, and they work. We treat the root cause. So root cause medicine is different than conventional medicine. Both are necessary. You have to know what you're looking for and the type of healing that you want. Root cause medicine is preventative. It's also good for acute and chronic conditions. So depending on what you have, it's always good to have a naturopathic doctor on your team. And I'm going to explain why. You're going to learn a lot more about that today. Doctor as teacher. So that's what I'm doing right now. So I love giving these webinars. I love sharing my medicine. That's how I work with my patients also. So you're always going to get information about yourself, what's going to help you. As naturopathic doctors, we don't treat symptoms. It's all, or a disease, we are healing a patient. So that's how it works. And it's a different mindset. So in naturopathic medical school, this was drilled into us. So this is how we believe, this is what we do. And nature cure, it's right in the name of what we do, of our medicine and who we are as doctors. So this includes nutrition, lifestyle, and supplements. So what you get is a big sheet of information. It's really a regular size piece of paper, but you know what I mean. There's a lot of information on this paper. And first and foremost, it starts with nutrition. Then lifestyle, lots of options that you can do to help you in your specific situation, as well as supplements that are necessary. So less is more. What I always tell my patients when they come in is bring all of your supplements with you. With telehealth right now, I ask them to go into the kitchen or wherever they have their supplements and show me the label so I can know what's in it. So sometimes, unfortunately, there aren't supplements that are so great. The ingredients in them are bad, or it's not what you need. And so there's definitely ways clinically looking how you present, as well as assessing lab work. We can see if those supplements are even necessary. And the point is to not have you on supplements forever, but to have you on supplements to bring the body back to balance so then you can wean off of the supplements. So that's a really big part of the picture. Oftentimes people are on supplements for years and years and years. And sometimes those supplements can be the root cause of what's going on, the reason of why they're not feeling unwell. So it's really something to think about. Go to a naturopathic doctor who understands this. We've been trained in supplements, so using botanical medicine, homeopathy, Bach remedies, minerals and vitamins. It's all a wonderful world when used correctly for your needs. And there are some supplements that you do need sometimes all the time, and the exceptions to that would be probiotics, which I'll be talking about, and perhaps vitamin D, particularly in the Northeast where we don't get a lot of sunshine. So when in doubt, treat the gut. So I love this saying because it was used over and over in naturopathic medical school, and it was used in clinic. Many of the doctors that taught us said it, and it was wonderful. In fact, I think we had a shirt, I still have a made shirt made up with one of them, naturopathic medical week, medicine week. And it was wonderful. So it's a wonderful reminder. That's a good starting point. And that's why gut health is so important. And that's why I'm talking about this today. So Hippocrates said it, let food be thy medicine and medicine be thy food. So we can't discount the food that we're eating and how it impacts our health, and how that food that we're eating impacts our gut health. Really important. But we're not just what we eat, we are what we absorb. So if you're eating all these foods, taking all these supplements, but your gut health is compromised and you're not absorbing it, you're not feeling better, you're not getting the nutrition and the nutrients and the vitamins and minerals, et cetera, that you need. Big problem, okay? And stress is a major factor with our health, and it has to do with our gut health here. And we all have stress, but what do I always ask my patients, any of my patients listening out there? Stress, I want you to rate stress on a scale of 1 to 10. or even zero. I've had people say, I don't have any stress at all. It's the way that you interpret the stressors that are happening to you. And stress is not only the way you interpret it, there's also stressors in our lives, right? So heavy metals, that presents a stressor in our life. Something like as simple as drinking plastic water bottles. You're not drinking water, you're drinking plastic water. That plastic is an endocrine disruptor. That's a major stressor on the body. That plastic is actually sitting in your tissue. They've done studies on this. And it's causing major disruption in your body, affecting your hormones, affecting your endocrine system, and putting a stress on your body. So there's lots to think about when it comes to stress, but how is it affecting you? Do you feel the stress? Are these stressors having a load on you, on your impact, how you're feeling? And how do you cope with stress, right? So this all plays a factor. And what's one of the best ways to release stress is our stress hormones releasing cortisol with exercise, right? And also having that tested, making sure that your cortisol, melatonin are in balance. So lots of things to think about stress. It's not something to be like, oh yeah, we all have stress, I'm so used to it. That doesn't have to be the case. You can feel a lot better. Your reaction to the stressors in your life can be calmed down, okay? So when you rate it, and you can think to yourself now, what is your stress on a scale of 1 to 10? If it's a 10 and it's up there, then that's where we have to start. Decrease that, and then the rest of the picture is going to unfold. So when we really get to that root cause, we're able to see more and get more information. It's really cool. So I love working with my patients with that, having an understanding and knowing what the stress load is and how to lessen that. And that's what I'm going to talk about today. And it's our interpretation of stress that matters. That's what I was just talking about. So that gut-brain connection is key. I'm going to talk about the microbiome, how it affects our mental health, our emotional health, our gut, the microbiome there, our gut health is a major factor there. And our organ system. So I put a picture, people are probably like, why is there a picture of the tongue here? So the tongue is the one muscle that we can see in our body without having an injury and having muscle tissue exposed, right? The tongue is a major muscle in our body. And what's cool about it is that's a microsystem, just like other microsystems that you may have heard of. The ear, our hands, and our feet. The tongue is also a microsystem, a very powerful microsystem that shows us what's going on in the organs, as well as a pulse diagnosis. So as an acupuncturist trained in Chinese medicine, I look at both the tongue and the pulse. What's particularly helpful now with telehealth is that I'm able to look at the tongue, and that gives me a snapshot of what's going on in the organs. So it's so cool. I love to do it. I know any acupuncturists out there are like, yay, show me your tongue, because we get so much information that can help you. So this is what it shows, is that the heart is right in the front. The lungs are behind the heart, and then the stomach and spleen is in the middle. The intestines are right behind that, and then the kidneys and the bladder are further back. And then on the sides is the liver and gallbladder. So when it comes to stress, I'm always wondering what their stress response is. And there's two big emotions, but there are more emotions that people feel. But the big ones that I see are anger and worry. And what does that have to do with? So anger is when the liver is out of balance, and worry is when the stomach and the spleen is out of balance, which is digestion, which is exactly what we're going to talk about today. So when you support your digestion, you support your gut health, people who tend to worry a lot, they can feel a lot better. And I can see them feeling better because the tongue has changes there in that central area. Pretty cool. So our nervous system has two systems, which you've probably heard me talk about if you've been on any of my meditations that I have on Wednesdays, is the parasympathetic nervous system. But the other guy that works in tandem with that is our sympathetic nervous system. So our sympathetic nervous system is our fight or flight system. We need it, but we don't need to have it all the time. It's just for survival mode. So think of a tiger running from a lion. You don't want to be doing that all the time. But what's happening in society nowadays is that people are so stressed all the time. And things like, unfortunately, being on a computer like you might be on, or the phone, being exposed to EMFs, having multiple things going on all the time can cause stress as well. Multitasking, what do we love to do? A lot of parents doing that now. You're trying to work, plus you're trying to be a parent, and doing all these things that can put your sympathetic nervous system into overdrive. That can cause stress. You just want that nervous system. It's very important. It's essential, but you want that adrenaline rush to be able to run from that lion to save your life for when you need it. But you don't need to be in that mode all the time. What you do need to be in more all the time, or most of the time rather, is that parasympathetic nervous system. So that is our rest and digest system. So think about that. Digest. What should you be doing when you're eating? Is resting, having a nice meal with loved ones, or sitting there and relaxing while you're eating. Really important components of supporting that parasympathetic nervous system. And it has a cranial sacral flow. So I really love this. If anyone's ever heard of cranial sacral therapy, it begins in the cranial nerves and it runs down to the sacrum. So how cool is that? It's, balancing that cerebral spinal fluid in between those, and it makes sense. So anyone who has a cranial sacral therapist or thinking about it, that's how it works. It helps to enact that parasympathetic nervous system, which really benefits your overall health. So restoring that parasympathetic nervous system is really important because it has so many benefits. It decreases the heart rate. Our sympathetic nervous system increases the heart rate to support us. So think about all the things to kind of restore this parasympathetic nervous system. I hope you're all thinking and saying, oh, is this what's going on? Why am I so stressed out? What could be going on? Let's, kind of reflect on what could be going on. So no multitasking, or at least try to decrease it. So try and do just one thing at a time. Could be really difficult. Sometimes, this can be fun for people. Like they love the game of it, the thrill of it, the excitement of multitasking, but it actually is affecting your nervous system. Okay, so not really the best state to be in, or at least limited if at all possible. Know those times in the day or things that you have to do for work, etc., where you do need to save yourself for that, but not to always be multitasking and always doing that. And consciously try to do things slowly. Okay, so that's going to help to restore that rest and digest system in your body. And that's why meditation is so important, because having that mindfulness in the now, being in that present moment, does wonderful things for your nervous system, which in turn then can help your gut health. So that's why I do those meditations, and that's why it's so important. So if anyone is having trouble with meditating or getting started or wanting to do it, let me know. Feel free to watch my videos. I try and make it fun and enjoyable and a topic to reflect on and think about. All those things are really important. Another really cool thing is light touch with your finger pads. So think about why kissing is so relaxing, because there's parasympathetic nervous system fibers that are in our lips. So how cool is that? So you could just take your finger pads and just kind of rub on your lips, sometimes your lower lip in particular. They did studies on animal studies, and they found that that's where the most parasympathetic nervous fibers are. So think about just rubbing that, maybe if you're on a call with work that's stressing you out, or the kids are stressing you out, or friends or family loved one, and just do that and see if that can kind of tap into your parasympathetic nervous system. So it's an active state that you can be in, something that you're doing to help relax you actually. I thought that was a pretty cool tip. Belly breathing. So instead of doing something called shallow breathing, which is using the top portion of your lungs only and using your trapezius muscles, your upper back and your neck, and causing constriction, you're breathing into your belly and you're getting all the oxygen in throughout your lungs to your belly, which is really important. It helps to ground you, and it gets that lung chi moving everywhere. So now, more than ever, I hope people are realizing how important lung health is. Pulmonary health, that's another term for lungs. That's one way to support your lungs. Do that deep belly breathing, or just deep breathing techniques, but breathe into the belly, not just the upper chest. Extend it down into the belly. It helps to support your nervous system for the better. And so doing visualizations also. So this can be done during meditation, but you can simply just, the power of the mind is so, it has such an effect on our health. We have so much control over it, really. When you have more control, when your body is feeling optimally healthy, you're able to tune in more to the imbalances in the body. But regardless, so what I'm talking about is visualizations. You can simply think of your favorite place in the world to be, your favorite vacation that you are on, and just, you can go back there in your mind, and you can just put yourself back on that wonderful beach, or in that cabin with the snow, just making you feel all cozy, whatever it is. Visualize that, or something that makes you happy, puppies, whatever it is. That can help to decrease the stress. But there's tons of effects that stress have on the body. So I'm going to talk about what it does to the body when you have this stress and you're in overload and it's not working for you. So with the digestive tract, tons of dysbiosis, tons of malabsorption, right? I was just talking about you're not just what you eat, you are what you absorb. And in turn, you have these deficiencies of nutrients. So really important to understand that, get really in-depth lab work done so that you know what you're deficient in. But also, if the root cause is leaky gut or inflammation in the gut, you've got to cut down on that inflammation. And if stress is causing the inflammation, you've got to decrease the stress. And that integrity of the gut lining, so that leaky gut, I'm going to talk about that more, but you don't want that inflammation contributing to leaky gut, and that stress could be the inflammation that's contributing to that. It also increases production of stomach acid, which is not necessarily a bad thing, but it could be a bad thing when it's too much all the time, or when you need that stomach acid to break down food. So if it's during a time when you're digesting and you're in that parasympathetic nervous system time, yet you've got this stress and then you've got this excess stomach acid when your body doesn't need it to break down food, that could pose a problem. And doing that chronically over time, big issue. Stomach ache or nausea, right? You just don't feel good. The cardiovascular system, so all sorts. So what I'm listing here is how stress is affecting all different body systems. With the heart, our cardiovascular system, the blood vessels constrict. It increases that heart rate and that blood pressure. It increases risk of heart attack. Ugh, you don't want that, right? And people feel that, if you have a susceptibility, that your cardiovascular system is also not optimal. You really want to decrease that stress, because if that's where you're going to feel it, that's a major organ that we need to survive. Not a good, place to be in, having stress and having it affect your heart. So you really want to get on top of that sooner than later. Lots of things that naturopathic medicine can do, right? Looking at inflammatory markers, specifically cardiac inflammatory markers, seeing where they are before it's too late. That's where preventative medicine is key and can help. The respiratory system, shortness of breath. If you're having shortness of breath, you got to go to the cardiologist and check out the heart, but you also have to go to your pulmonologist. Figure that out. I've been telling people to get the pulse ox. You put it right on your finger. Preferably if you don't have nail polish on. Some of them work better that way. You put it in within seconds. It's going to tell you what your blood oxygen level is. Really important to know. So if you've got shortness of breath, stress can cause it. If this is a constant thing going on, you want to get to the root cause. Why do you have the shortness of breath? Is there something else going on? You also don't want the stress to exacerbate it, right? But what's really important now is that stress weakens our immune system. That's not a state that you want to be in, okay? So the stress of what's going on with this pandemic, the stress of now income not coming in, the stress of being home all the time, the stress of being around some family members, perhaps you're not getting along. It's all stressful, but it's weakening your immune system. So you have to rise above, figure out proper immune support for you. That's different across the board. Not everyone should be taking the same immune support. There are some things that play a role pretty much across the board, but not necessarily. So you really want to check in with your naturopathic doctor for proper immune support for you. Hormonal health, right? Do you have decreased libido? Is your menses not regular? Missing some of them? Erectile dysfunction, fertility problems? Are you stressed out? That's a major factor with your hormones. So get that under control. You can also do testing, but if you're really stressed out, start there also. So I'm giving all these tips that you can do without the lab work, okay? More effects of stress on the body, because the list goes on and on. Your energy is hit, right? You just so fatigued. Is it the stress? Is it something more? Okay, so as a naturopathic doctor, we're looking at all these things, but it definitely cuts out your energy. Insomnia. Why aren't you sleeping well? What's going on? I use the Chinese medicine clock. I try to find out from my patients, when are you waking up in the middle of the night? All these things are factors, but if you're really stressed out, your mind's going, it's waking you up, you're not feeling rested when you get up, major issue there. Figure out what the stress is that's causing that, and hopefully then you can get a good night's sleep. Insomnia can be very confusing in a lot of cases. So I'm just giving you perhaps a starting point, but lots of things to look at. Weight gain, particularly in the abdomen, right? So abdominal adipose, that's what we call it. It lodges right there. So when there's a lot of stress, your body's holding on to it because you're in that fight or flight mode, that sympathetic nervous system. So your body's not properly working and digesting and doing all the things that it needs to do. And it's kind of just holding on to everything for survival mode. So, and it can get stuck there. So, and weight gain in general can be an issue. decrease the stress, you can see some decreases there. If that's an issue that you're having, increases blood sugar, the liver releases extra glucose into your bloodstream. Okay, no need for that. Mood disorders, the gut-brain connection, it's real, it's happening, it's a major problem. And also tense muscles. Okay, so that stress, I was talking about when you do that shallow breathing or wherever you might feel it in your body. So I'll ask people when they're going through stressful situations, well, where in your body do you feel it? People will say, oh yeah, I feel it in my head, or I always get a headache. Oh, I get a stomach ache. Oh, my arm starts hurting me, or, I feel it in my calves, or, wherever it is. Where's that stress affecting you? Is it affecting your musculoskeletal system? And then there's things to think about, magnesium for cramping or et cetera, but is it the stress that's really causing your muscles to just tense up and constrict? So which is why I always talk about eating and drinking warm teas rather, that open up the vessels in your cardiovascular system, in your arteries and your veins, in your lymphatic system, and it gets things moving and flowing. Cold drinks can just constrict, okay? And it, you tighten things up. You don't really want that. You want free flow within all those systems. And in Chinese medicine, we're always talking about the free flow of the qi. So there you go. Drink your nice warm teas. And the GI tract. So ask yourself, how is the whole entire GI tract doing? So this starts in your mouth and it goes all the way to your anus. So that's a long path for it to follow. It's going all throughout the body there. Think about your oral hygiene. When was the last time you went to the dentist? How was that? Did you have any cavities? Do you have gingivitis? Do you bleed when you're flossing? Do you bleed when you're brushing your teeth? Lots of things to think about with oral hygiene. And then also pelvic floor health. So I'll give a shout out to Rachel, who runs Lotus Physical Therapy. She is a wonderful pelvic floor therapist. The pelvic floor often gets overlooked. If you're having any pain there, go and see a specialist that can help you with your pelvic floor. Do your Kegels, get that under control. A lot of people are having pain that they can easily get fixed seeing the proper pelvic floor therapist and figuring out what's going on there. Okay, lots of help that can be done there with that specialty. Find one near you, and they're also doing telehealth, so plenty of ways to get that under control. So a healthy gut. So we need healthy flora, right? That's what I was talking about with probiotics. Different probiotics. There's more and more research coming out all the time with different strains that might be better for certain issues. So there's all different kinds that are out there that we'll use at Inner Source Health for our patients, depending on what's going on. And getting a good quality probiotic is a very, very, very important. Can't stress that enough. And then what are prebiotics? So a lot of times people are confused with this. So prebiotics are the fiber that feed the probiotics, right? Pre-food, okay? So pre-food for the probiotics. That's what the prebiotics are. And where do you get these from? Wonderful world of veggies, right? Eat foods with tons of fiber. Super important for gut health. Diversity of the microbiome. So I'm going to get into that, which is really important. Proper absorption and digestion. That's what we need. So I've been talking about that. Makes sense. And having optimal bowel movements. So we'll dig more into that. So the microbiome. What is this microbiome? You've probably heard this term. So let's talk a bit about it. So it's these live microbes that's on the body and inside the human body. So yes, it's on our skin. Yeah, there's even a probiotic cream that you can get that's out there, which is wonderful. So any skin issues, so when the skin is having rashes or issues there, as a naturopathic doctor, we always want to look at gut health. What's going on there? Why are you constantly having these skin issues? Okay. Oral health. The vagina also has microbiome, as well as amniotic fluid, umbilical cord, and the placenta. So that's all really important to know. Medicine used to say that those were sterile environments. Not true. There's actually a whole world of microbiomes there. But also the gut. So super important. That's where most of it lies. So that's why we're talking about gut health and the microbiome. The microbiome helps with digestion, immune support, like I was talking about, and it prevents infection. So really important. And that's why it's important now more than ever. It's always important. So that's what's so wonderful with naturopathic medicine. The things that we learned in school, the way that we practice has not changed during this pandemic. There's the things that are helpful for the people has always been helpful. That's what we do. And that's what I encourage my patients to think about their own health, because knowing if there's any chronic conditions, reversing that before it worsens, and especially now is very important. So understanding what your microbiome is doing and your gut health only helps you now during this time. It's very important not to forget that, and to eat proper foods for you. So the microbiome also includes bacteria. Obviously, that's what we're talking about, right? Good bacteria, probiotics, viruses, fungal infections that are there, protozoa, and it's also genetic material. So facts about the microbiome: weighs up to as much as 5 pounds. That's a lot, okay? It's considered a separate organ. It has distinct metabolic and immune activity. So huge with our immune system. So you have to have good gut health to have a functioning immune system. So most of our immune tissue is in the gut. Like 70 to 80%, if not more, is lying there in the gut. Really important. So when you think about immune support, I want to know, how's your digestive health, okay? How are your bowel movements? How are you feeling? Are you having any pain or any discomfort there? Very, very, very important. There's 10 times the amount of microbial cells in the gut than the entire body. So that's why we're talking about gut health so much. There's 100 trillion bacteria in the gut. There's a lot going on in there. And you want it to be a diverse, think about a garden. You want all different herbs and flowers and plants in your garden. Nice diversity, okay? Wonderful world of garden there. Wonderful world of microbiome. Very, very, very important. The fetal microbiome actually gets transmitted from the mother. So this affects our fetal development, and it also goes on to affect us in adulthood. So research is coming out about this. And again, all of studies through PubMed and medical journals, they are all at the end of this PowerPoint. So feel free to click on any of those to read more about it if that's something that you're interested in. This microbiome, it's influenced by delivery. So vaginal births versus C-section. So it's different flora, okay? The vaginal flora is full of that world of lactobacillus. And when there's a natural birth that way, then the infant gets that natural flora that helps them within their microbiome, right? So it goes through their whole GI tract. In their mouth, it's getting passed through all the way through their anus. They're getting that lactobacillus in. C-sections, it's different. So, and the studies here at the end of it, there's an overgrowth of staph, E. coli, and Cornea bacterium. I think that I said that right. So it's important to understand that, not to just education. I think that it's important to know. So, and what they do find out is that when vaginal versus C-section, there's a difference also with C-section babies, that they tend to have more, there's called the triad of allergies, asthma, and atopic dermatitis, directly linked with gut health. So this bacteria that is happening during delivery, there's an exchange of it, but it's also important because that fetal microbiome that is transmitted from the mother. So you have a lot power in you as the mother to have your microbiome as healthy as possible, because you're transmitting that to your child. So if you are, having to have a C-section because it needs to be scheduled that way for whatever medical reason, there's lots of things that you can do to try and also provide the proper microbiome for your child. So, and there's also a difference between breast milk versus formula feeding affects the microbiome in children and little baby infants. And as age of 2 years old, it's the microbiome stabilizes and resembles that of an adult microbiota, which is very cool. So optimal microbiome. This is what we're all striving for. You want diversity, right? I was talking about that garden full of all different good bacteria that are just kind of skipping around with rainbows and golden pots all around, right? It's anti-inflammatory. This is optimal health. Okay, if there's a lack of diversity in this microbiome, major problem, because this is inflammatory. So, and then you see frailty also, and it's also contributing. So with the aging process, this is also, it's a kind of a natural process that happens with aging. There's a lack of diversity in the microbiome. So get ahead of it, knowing that this could be a problem. Take your probiotics, eat the proper foods, do what you need to do to decrease your stress, get your gut health under control. It can help you with the aging process, because we know that this is kind of a natural phenomenon. And then a lack of diversity is also is connected with increased risk of chronic disease. So if there are any chronic ailments, I talk about this all the time. I talk about my own personal experience with autoimmune condition, mild obstructive lung disease. If I was still suffering from those conditions, one or both of them, I was at major risk during this time. Okay. Having my respiratory system under control and reversing my mild obstructive lung disease, key. I am so grateful that I did that. Reversing my autoimmune condition, key, so that I can feel better, but also during this time, because it protects me against any infection, any illness, and also supports my immune system, which is a major factor with what's going on in this day and age, but all the time. So everything I'm talking about, it's not just to pay attention to now when we're in this pandemic, it's all the time. Because let's face it, this isn't going to be the last virus that we're going to be facing as humans. So negative impacts on microbiome. So things to think about. So antibiotic therapy. I know for myself, this was a major factor. Affected my flora. So if you have a history of being treated with antibiotics, if you're currently been on antibiotics, so I'm seeing this a lot now in my practice, patients who were treated with antibiotics for COVID-19, and now their gut health is really suffering. So now I have to go back, whether, we're looking at testing or just go in there, I can tell clinically with symptoms what's going on and support their microbiome. Really important to do that. But how inefficient is this to have to backtrack when there are plenty of natural antibiotics that could have been using, natural antivirals that could have been going on during this time, support the immune system properly so we don't have to backtrack. Or what you can do, so naturopathic medicine can support conventional medicine. You can have a team of doctors on you for your health and wellness. Get a naturopathic doctor on your side while you're getting treatment with conventional medicine, if that's the path that you choose. And then you could be taking your probiotics. So if you're taking an antibiotic therapy, make sure that you're taking a good quality probiotic 4 hours, 4 hours away from the antibiotic. Okay, you really need to support your gut health and your microbiome if you're taking antibiotics, because those antibiotics, yeah, they're wiping out the bad guys, but they're also wiping out the good guys, causing major dysbiosis in the gut, major problem. Early using antibiotics in your earlier life as an infant, as a kid, shifts that bacterial profile to promote obesity, autoimmunity, metabolic abnormalities. Okay. So, I always reflect on myself and I wonder, why did I develop an autoimmune condition? Oh, I had strep throat and was constantly treated with antibiotics. That's just what they did back then. Not pointing any fingers. I know that my parents had my best interests at heart, but that's kind of the road when I grew up. That's what people were doing. Now we know better. There's so many ways that you can approach it naturally, but what do? I get ahead of that, support my microbiome, and you can in fact change the health of your microbiome with natural remedies, eating right, taking care of yourself, and decreasing the stress that we've been talking about. Right. And then so antibiotic use in livestock, so they're using antibiotics for all the wrong reasons. They're doing it prophylactically and they're doing it greedily, is that a word? They're doing it out of greed to enhance the growth of the muscles in these animals that they're raising for food, and increasing their weight so that there's more tissue, more meat on them for people to eat. That's not what antibiotics are used. Antibiotics were used, and it was a great invention, but they were supposed to be used for acute infections, right? Life or death, make sure the antibiotic works. What's happening is this is building up antibiotic resistance, major problem. That means that these antibiotics aren't going to work when they want to, and they replicate way more than anyone's going to be able to create another antibiotic to fight that superbug or that bacteria. So major problem. You definitely, if you're using antibiotics, conventional medicine, pharmaceutical therapy, make sure it's because you definitely need it. So definitely try natural antibiotics because the body doesn't build up a resistance to them. Okay. I'm talking about raw garlic, manuka honey. There's a wonderful world of antibiotics and antivirals out there. Use food as medicine to get the effects that you want to help you. But then if you're in a crisis or you're a bad situation and you need the antibiotics, then they're there to work on your side, right? Major difference. How can you test your microbiome? Yes, you can. That's what naturopathic doctors do. We want to look at your stool. First of all, we're always asking everything about your poo, right? Then we want to look and test it. So any naturopathic doctors out there probably going to know the test that I'm talking about. But there's it's called fecal test. So you submit your stool and it quantifies. So it doesn't just tell us a positive or a negative, which that can still sometimes be helpful. But if we're willing to do this and really dig deep, this test is great. It shows the pathogenic bacteria in there, viruses, the fungi, and the parasites. Okay, all important to know what the levels are there. So it shows the normal bacteria, which is good. So the problem is if the normal bacteria is low, problems with the gut health. It also shows opportunistic bacteria too, which this presents, and when there's an illness, particularly when this opportunistic bacteria is high with the immune compromised, okay? So there's a lot of information now coming out about Prevotella bacteria and its connection with this COVID and how it's connected, and they're kind of feeding off each other. They're both replicating, getting worse, and this Prevotella is found highest in those with cardiovascular conditions as well as diabetes. So again, getting your chronic conditions under control so that you don't have these overgrowth of the opportunistic bacteria that come in and wreak havoc when you have these predispositions to these conditions. Get it under control so you don't get the overgrowth of these opportunistic bacteria. But what's worse is they find Prevotella in the respiratory tract infections. So major link with coronavirus. So a lot of information about that. So just a testament to saying how important it is to have a good diversity of the good bacteria in your microbiome, have your microbiome tested, and have it in good health with all the things that I'm talking about today. This test also shows intestinal health markers. So really important, we could see if there's any dysbiosis, any inflammation on the rise, or pinpoint exactly what's going on. And what's even cooler is that it shows these antibiotic resistant genes. So if you're someone who's always taking antibiotic therapy, it's just the course that you choose to take, you get this test, then when you go to the doctor, oh, actually I have a resistance against this antibiotic, then they have to choose something different. So no need to just wipe out your gut flora with another antibiotic that's not going to work. Now and you have those answers. I think it's really empowering to have these answers and know. The more you know, the more you have control over your health and you can get your health on track. Really important. So how can you improve your microbiome health? So they know, and again, all the links, these PubMed studies are at the end of this PowerPoint. There's a difference in the microbiome between lean individuals and obese individuals. Not to say, there's also that, they call it that skinny fat, so there's a lot of people out there, just because they look lean and thin and they think that they're healthy, but their microbiome can be a mess. I see it all the time. So this is not to say that, skinny is in, healthy is in, is what I'm talking about. But these studies are important, and it gives us some insight also to be feeling good and feeling well. Diabetes and metabolic syndrome. So they have fewer anti-inflammatory bacteria. So that's what I was talking about with that overgrowth of the opportunistic bacteria, talking about Prevotella problems. It's connected with those two types of diseases, those chronic conditions. Know if you have any chronic conditions, reverse them. Get a doctor that tests inflammatory markers or tests, does preventative medicine to know if something's on the rise, reverse it before it's too late. Atherosclerosis. So it increases something called TMAO, okay, trimethylamine monoxide. This is linked with increased risk of heart disease and cardiovascular events, right? So eating inflammatory foods that causes this topic in itself is a whole, webinar, but that's linked with, that's something that you don't want increased, okay? And fecal transplants. But why have to go through that when you can just eat good food? But it's there for you. The studies are there. The information is out there that fecal transplants can work. And sometimes things have gotten so bad. Sometimes infections are so bad. The microbiome has been compromised. The gut health has been going on. It's been a problem for so long. And these fecal transplants are working, has been going on for years, actually. So, probably not the first thing that you want to try, but it's an option out there. But why don't you just try eating some veggies and eating good food, eating foods that are inflammatory, not opting for processed foods? so that you don't have to do fecal transplants, but we have the options there. So I think it's pretty cool. And then why do I have a picture of my dear sweet Chloe on this? Because there's even a study, the link's going to be in there at the bottom. It was a PubMed study. Dog exposure is protective against allergic airway issues and respiratory viruses. That is why I kiss my dog all the time. Okay, let the truth be told. I kiss her. I love her. I think she has the sweetest little lips. She is such an adorable one. So there you go. Dogs help your health. Proper digestion. So you want good, proper digestion because you feel great. You're able to move with ease, right? You just know things. I ask people this all the time. They know if their gut's feeling well or not. The bowel movements, they're easy to pass, they're formed, and you feel fully evacuated, right? You know, like, oof, it's all come out. You feel good. You want to like stand at the top of a mountain and just go, yeah. And when I'm asking people if they have poor digestion, I can tell by just the look on their face. They're not having good bowel movements. And this can lead to poor mood, fatigue. So that's the number one thing. When my patients have fatigue, their energy is low. They're probably so used to like, yeah, I have poor energy. You know, that's just the way that it goes. Doesn't have to be that way. If it's your gut health is off, you have to improve your microbiome. So let's start there. Let's fix that. And voila, you get your energy back. Your mood is boosted. Brain fog too. So sometimes people are just like, oh, I just can't think right. If your gut health is compromised, that's the place to start. We got to start there. Okay. There's tons of things also, vibrational healing, blah, 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 all these things. But if we have to bring the cognition back and feeling better and that gut brain health, huge connection, let's start with the gut. Any abdominal discomfort, so gas, belching, bloating, okay? That means things are moving the opposite way. They're moving out, they're moving up. They're not going where they need to go. It doesn't have to be the case. Sometimes people are like, oh yeah, I always get bloated after food. I'm used to that. Well, then obviously you're eating something wrong, or there's something wrong with your gut health or your microbiome's compromised. So let's get that under control so that you don't have to feel bloated. You should be able to go, well, now you can't go out, but you should be able to have a nice meal and then go sit and watch Netflix without having bloating, right? Correct? Yes. And when the people's gut health gets under control, that's what they report back to me. It's really wonderful. Reflux, nausea, diarrhea, loose stools, constipation, all of it. Let's get a hold of your digestion. Let's figure out what's going on. Are there any infections, overgrowth of candida? What's going on? Skin irritation, right? I was talking about the skin. Have to look deeper into the microbiome. Look at the gut health, because what was I saying? Our skin also has a wonderful world of microbiome that it has. So, and our skin is our largest organ. So, got to look deeper in the gut. There's a connection there. And what also can cause poor digestion? Why are we here today? Stress, right? So compromised gut. So what you want, I'm going to talk about all these things. So it's listed here, is that you want, and I think that these pictures kind of give a good description, and I'm going to describe it too, is that the gut lining, you want these tight junctions in the gut. So that way you absorb all the nutrients, kind of easily pass through the gut lining to help you and your body work. What happens when you eat inflammatory foods or have inflammatory situations or have a lot of stress? There's something called leaky gut. And what it means is that these gap junctions have little holes in them. So what does that mean? That the proteins in the food, instead of going through and passing through the intestines, getting processed how they need to, proteins in the food come out of these gap junctions, which are now not tight, they're open. And now these proteins are in the bloodstream, not where they belong. And it wreaks havoc on the body, causing all these things like I was talking about: brain fog, depression, anxiety, skin irritation, joint pain, all the discomfort in your stomach, all because of the leaky gut. So decreasing the inflammation, looking at all these things, making sure that your gut health is good and that you've got these tight gap junctions in there. Have a naturopathic doctor who can help you get that under control. Healing the gut. And this can take it can be different for a lot of different people. If you have a chronic condition, it can really vary. So you want to decrease the stress. You want to have proper absorption of real, actual food, whole food, plant-based food. You want to support your digestive fire. Okay. And I've done talks just about supporting the digestive fire. So, and I'm going to talk about a little bit, daily detox, okay? Because there are toxins that are just in this world. It's in the air, it's in the water. It's kind of all right. It's in, the air we're breathing. It's just everywhere, these little toxins. Trying to get organic, non-GMO food, of course, is optimal, but you also want a daily detox. What's the best way to do it? Sweat through the skin, okay? You wanna make sure the liver's working properly. You wanna make sure the kidneys are working properly, and you wanna make sure that you're having proper excretions from the stool, from your urine, okay? Any issues with that, you have to know that things might be backed up, and then there could be a toxic buildup in there. And so healing the gut can be different for each person. So ask yourself how you feel after meals. Okay, sometimes I'll tell my patients, do a food log and include your mood, your energy. So whatever's affecting the person, then I'm going to, make that specific for them. But it really helps, and it gives insight also to the patient with what's going on. So feel free to start doing this. So check your energy levels, and how are you feeling? And this could be immediately after the meal, 30 minutes after the meal, a couple hours. Check in with how you're feeling. How's your mood? Did your mood just suddenly shift? Is it connected to your meal? Any signs of poor digestion? Everything that I was talking about before. Eating on the go. Okay, so this is a big topic, and one to talk about now, and kind of one that you can try and get a handle on now while we're in quarantine. So if you're eating on the go, you have to think of the whole process of proper digestion. So it starts with smelling the food, salivating, getting the amylase started there in the mouth to break down the food with the enzyme production, and then sitting relaxed to eat. The enzymes are breaking down the food, you have proper hydrochloric acid, and then you just feel so relaxed. You're in that rest and digest mood that helps to support your parasympathetic nervous system so that you can digest properly. If you're eating on the go, all those things aren't happening, okay? And especially if you're just grabbing food that hasn't been cooked, there's something to do with cooking, cooking together, smelling the food has a major impact on your digestion. So definitely something to think about if at all possible. Why not start now, when we're inside? So food prep, so the stomach is an acidic environment. So you want to support the digestive fire, okay? It's important, this particularly when people who are on proton pump inhibitors, those PPIs like omeprazole, things like that, that block acid production. So long term, that's not the answer because the stomach is an acidic environment. You need it to break down food. You want a right balance of everything, right? With all of the organs. You want warm foods and drinks to support that digestive fire. So that warmth helps, right? It was talking about expanding the arteries and veins and lymphatic system. It's also warming. So digestive fires, they're warm. You want those warm foods to support it too. Makes sense. And are you eating a lot of cold and raw foods often? A lot of salads, smoothies, iced coffees? Those could be cooling your digestive fire and then constricting your vessels too. So a lot of warm teas, soups and stews and broths. So especially, we've had a lot of rainy days lately. So doing that, cooking those can be really nice and really soothing and comforting. Steamed or lightly sauteed foods, right? So lots of options to do with that. I call it the raw food sandwich. So if you have to have that salad, right, I just saute all my food. So if you're having any digestive issues. So if you're not having digestive issues, I want to make this clear. Raw food is great, right? Nutrient dense, you gotta have all the live living food. It's great for you. But having digestive issues, you gotta rethink how you're eating the food because you want to be absorbing the food. Don't have these digestive issues to support your digestive fire. So if that's the case, then have a nice cup of soup. Have your salad. If you can't heat the salad, you can still eat the salad and heat it up. I know people think it's weird, but you can do it. And then have a nice tea, maybe like a ginger tea after you have that meal. So nutrition, so whole food, plant-based, optimal, right? Fiber rich, tons of antioxidants, so you're eating the rainbow. It's naturally anti-inflammatory. And of course, avoid processed foods. So those breads, why is gluten so bad for you? Because it's inflammatory, whether you have celiac or not, gluten's inflammatory as it gets. Dairy is also inflammatory as well as sugar. It's addictive and there's no need for it when you're trying to optimize your gut health. So stress management, tons of things to do. So is it with cortisol? Is your cortisol not waking you up in the morning? And you want to work on something called your cortisol awakening response. So get out in sunshine, or if it's bad weather, you can just open up your blinds, make sure that the sun's shining on you within the first half hour of waking up rather. Really important, get that exposure. Breathing techniques. So I was talking about that deep belly breathing, how important that is, or 4 square breathing, alternate nostril breathing. So if anyone's interested, I do my weekly meditations and go into detail with that. Self-talk. What's your self-talk? Are you putting yourself down every day? And that's causing you stress, you know? Be nice to yourself. Be good to yourself. You deserve it. Meditation, can't stress it enough. It really helps to manage stress. Having a gratitude practice, simply just being grateful changes your vibration. It is a way of then attracting more goodness into your life. How can you get, you know, add on wonderful things to your life if all you're doing is complaining about everything and you're not grateful for anything? So being grateful for all the little things, incorporating that gratitude practice. So lots of ways to do that. I'm always talking about that stuff. Eat right for the healthy gut flora and hydrate. Okay, so the cells are thirsty. We're mostly made of water. Make sure you're drinking good water and quality water, right? Not these plastic water bottles. That's not water, that's plastic water. You want to be drinking quality filtered water. Essential oils, the wonderful world of essential oils. Oh, this is what I made around the holiday season for gifts for everybody. And I used some liquid coconut oil and the Himalayan sea salts from the Montauk Salt Cave. They gave some to me that was so nice. And it was so, oh God, it smelled so wonderful making these. And I made different combinations for everybody. So wonderful world of essential oils. You can diffuse them, smell them. You can rub them with the carrier oil and rub them on the bottom of your feet, right? I was talking about those microsystems, the foot being one of them. And you can rub that in. It can help support your organs through your feet. Really wonderful. Workout. So I talk about the blood type specific diet. So for the sake of time, probably won't get into that, but if anyone's curious, that can really help you. Okay. So, working out, making sure that you're boosting your cortisol, you know, whatever, I'll just talk about it. So they burn their cortisol, and workouts that can really help them. And this is about 80% of the time true. It really helps, especially if someone's stuck with their workouts. So I hope that this helps somebody out there. O's they release stress with doing strength training. I'm an O, and I know that works. And I really benefit from that. A's they release stress hormones with doing yoga and Pilates. Even meditation is something that's really good for you. So don't discount meditation. Could really help you with your stress hormones. B's are really good with doing things outside, like hiking, biking, golf, tennis, and then like anything outdoors. I mean, being outdoors is really good for anyone, for those negative ions, being out in nature, but B's particularly. And then ABs are kind of a combination of all of them. So getting a nice healthy balance with them helps with the ABs. Bedtime hygiene. So all the wonderful things that you can do an hour before bed, not being on the computer or TV. So if you're watching this now before bed, just turn it off, go to bed, and have that hour of avoiding the blue light, drink a cup of chamomile tea, have an Epsom salt bath. Hopefully it'll help your health. And then as naturopathic doctors, we were taught this in school, the 4R protocol. So RID, so you got to get rid of the offending agents. You have to, if stress is a factor, decrease the stress, figure out a way to decrease stress. And naturopathic medicine is definitely, this is one of the things that we work with our patients, and it really does help. Get any lab work done, check for heavy metals, you know, all these things. Replace is in the next part of this 4R protocol. Enzymes, hydrochloric acid, get proper food in for the proper nutrition. Then you have to repopulate probiotics, prebiotics, okay? Probiotics, you can eat fermented foods. Yes, it's not gonna hurt. But having a good quality probiotic is important. And again, this differs with each person. So there's one where there's a few that we use in our office, and it depends on the situation and what's going on. So it really does depend on you and what's going on. So see your naturopathic doctor and get the right probiotic for you. Repairing, so get the micronutrients that you need. Figure out what you're deficient in. Get the micronutrients to help support you. Drink your soothing teas, those warm teas. Soothing teas are going to help. Have a cup of soup a day, or just drink soups. If your gut health is really compromised, why eat food to make it worse, especially if you're constipated? Have some soups. That way it's going to be easier in your digestion. And having proper supplements. So I put if anyone's familiar with Bach remedies, so I make custom Bach remedies in my office, but these are easy enough to buy. So if someone's having a lot of anxiety and they need to calm down, so now this is something that you can purchase at CVS or Walgreens, Duane Reade. They're these little lozenges. They're pretty effective, so you don't have to pop a whole bunch of them. Take one at a time, because you will feel relaxed. You'll feel the stress come down. Really effective. But always, still work with a doctor who's trained in supplementation. But this is a good, fairly safe way to calm down any stress or anxiety acutely before you're able to get to a doctor. Proper supplements at good quality. We have supplements in our dispensary, third-party tested, very important part of the picture. So having good quality probiotics, vitamin A, vitamin B, C, and vitamin D, having vitamin D at the proper level, right? So between 60 and 80 is optimal. If you're below that, go find a doctor that can get you to the right level. It's a proper way to take the amount of vitamin D for your specific needs. Omega-3s, tons of options with that if that's what you need. Omega-3s are more anti-inflammatory, but you always want to have a balance of omega-3s and 6s in the body. Bach remedy, what I was talking about there, and wonderful. They're flower essences. They're really beautiful, beautiful medicine. Herbs. So there's a wonderful world of herbs. You get adaptogens if that's what you need. Nervines, anything that's neuroprotective, any sedatives. So if that's going to help to decrease the stress, go for it. But take what you need. Don't just take a shot in the dark and think that's what you need. Make sure you're taking the right herbs for you. Do you need supplements to balance out your hormones? Get your hormones tested, figure out where they're at, and then take the proper supplements. You'll feel a lot better. Sleep support, melatonin, but do you need melatonin? Get it tested, find out if that's what's going on. Magnesium glycinate can be really great. If you're taking that supplement, make sure you're taking it a half hour before bedtime. That's going to be a great way to calm down and then perhaps help your sleep too. So feel free to follow me. Thanks for joining. I'm going to try and answer these questions here. You can follow me on Instagram, DrDawnND. You can follow me on my professional page on Facebook, DrDawnND. And you can reach me on my email, Dr. Dawn, DrDawn @innersourcehealth.com, and follow us on our website. Here are all the references. So definitely access this PowerPoint if you're interested in looking at any of that. And thank you. So, the lozenges, those are called Bach remedies. So if you want to just pick those up, they're in, any of those stores that I mentioned. They're really great. So, but tons of things, if you're ever following any of our webinars, Dr. Buongiorno, he has done wonderful talks about anxiety and depression. So definitely check those out too. But that was just like a quick thing. I think that those flower essences are really wonderful. Particularly, I do custom ones, so I love doing those also. So let's see. Okay. Yeah, Kelly. So I think that a lot of these so can gut issues be triggered by food insensitivities or intolerances? Of course. Yeah. So those main culprits that I was talking about, any processed foods, gluten, dairy, and sugar, big ones out there. And elimination diet. Yeah, so pick a food at a time, eliminate it from your diet. Then about every 72 hours, then introduce that food back, see if it's causing any problems. If that's not the one, then choose another food, and then you can do that elimination diet that way. The true way to do the elimination diet, though, is cut out for about a month. But that's a quicker way to do it if you wanted to check, because sometimes you don't have those reactions within about 72 hours when you're eating those food that are causing those sensitivities. Yep. So the PowerPoint, yeah. So this is all going to be uploaded to YouTube, so you'll be able to see this webinar. And yep. Okay, great. Yeah, just make sure that you're signed up. Shoot me an email. As long as you're on our email list, then you're going to get a copy of this. As long as you've signed up for this, I'm going to have your email and I'll be sending it out. You're all welcome. Okay, looks like everyone's thanking. I think someone gave a hand up. Don't know if I can see you, but question and answer. Let's see. Okay, yeah, so healing leaky gut. So that's pretty much everything that I was kind of talking about during this. So really important if inflammation is that underlying cause. So during that 4R protocol. So if you want to go back to what I was talking about, so finding out, rid, replace, repopulate, those are all important factors to consider. So as naturopathic doctors, that's what we're doing. and that's the way to heal it. But you want to take out those offending agents. So that's why this webinar is so important, because a lot of times stress can be that offending agent. So, but if you wanted any more specific questions, I'm always open to doing free 10-minute calls. So if you want to discuss your particular issue, if you think that you're affected with leaky gut, you want to find out how naturopathic medicine can help, just give us a call. We can schedule that 10-minute call with you. Happy to help discuss naturopathic medicine and if it can help you with your particular situation. So you can just call, you can email, the email listed here, give a call at the office and speak with Lindsay, our lovely office manager, at 631-421-1848. So thanks, everyone. Oh, Megan. Hi, Megan. Awesome. Great to see everybody here. So thanks for tuning in. Bye now.